I was surprised to receive the scholarship because I think when you grow up gay, you sort of internalize this idea that you aren't valued. And it takes a lot to overcome that. And even now, I do have pride in my sexuality and who I am. But to receive a scholarship that sort of tells me that I'm worthy of that money and that my sexual identity doesn't really devalue me or make me worthless it's surprising. I think what motivated me to go into medical school was basically my desire to become a physician to help people. Mental health is a really important field that is sort of underplayed and not really all that valued. And then I want to do internal medicine with a fellowship in infectious disease because that's where you sort of learn how to juggle medications to manage HIV. I want to be able to be a physician that I never really had growing up. Someone who understands financial hardships, someone who identifies as LGBT. It's sort of like, I want to be the doctor that I never had. I grew up in Las Vegas, then I moved to Minnesota for college. Then after college, took a quick gap year and applied to Touro. Now I'm here. My parents both work in the food industry. So, poor working class upbringing, but I think it helped me build characteristics of, resilience and perseverance. We never really had insurance growing up. And when your parents are poor, you pick up on small things, If we ever had any health problems, we would basically have to wait until it was something really serious to go to the hospital or to see the doctors. And that kind of inspired me to become a physician, to see how exactly can I change the system and what can I do about it. And that's what really inspired me to become a physician.
Steven is an incredibly passionate and sensitive individual. He wears his heart on his sleeve. You know that he cares about you as a friend, as an individual, and you know that that's going to translate into great patient care when he's out there working.
What I admire about Touro are the professors that really care, that they're worried that students might be burning out because that's well known in medical school curriculum. Professors really try to care for our well-being, making sure that doesn't happen to us, making sure that we still have our compassion and empathy when we graduate. I think when you identify as gay, you grow up with a different perspective because the society more or less values being heterosexual, and having to come to terms with that, it's difficult, but it gives you a different perspective. And so I think I can provide that perspective as a physician. If I find someone in the same hardships that I faced, I really do want to help them see them through it, to get them through the same problems that I had. The most satisfying thing you could do is basically to help other people. And that's why I really wanted to be a physician, and that's why I'm here.